As one of the leading hospitals in the region, how do you go about choosing the equipment you use?
Equipment is selected in a couple of different ways. One is replacement equipment, so equipment we've used for some time that's run its natural life and is now ready for replacement. Or as technology improves and gets better, then that's the other opportunity for us to take a look at enhancing that equipment so that it is truly state-of-the-art. So when it's replacement equipment, then again we monitor its useful life, and as it ends its useful life, then we'll go ahead and replace that equipment with the latest state-of-the-art equipment. But as the technology changes and new state-of-the-art equipment is put onto the market, then we'll study that equipment. We put together a technology equipment that consists of all the various different users of that equipment to determine whether or not that is a piece of equipment that we should invest in.
What are some of the latest pieces of equipment you have invested in?
There are a number of pieces of equipment that we've invested in. One is relative to comprehensive cancer care, and that one piece is ablation therapy, and this is equipment or therapy for people who have thyroid cancer. When the thyroid cancer is surgically removed, sometimes there's thyroid tissue that remains, and so this therapy uses radioiodine to get rid of that additional tissue so that the recurrence of that cancer is significantly less. We also have a linear accelerator, state-of-the-art, one-of-a-kind in Dubai, and this is technology that can pinpoint tumors very specifically and eradicate those tumors without damaging tissues around that tumor itself. And then we've got a SPECT CT piece of equipment, and what this does is gives a 3D image of a tumor, so it can give you, again, pinpoint accuracy in terms of where the tumor is, the extent of the tumor, so the physicians can appropriately treat that. We also have a new Cath Lab that's just state-of-the-art that opened up several months ago, and we're opening up an acute rehabilitation center, and this is a center that takes care of patients who have some form of brain injury or spinal cord injury. And the great thing about that is that there's all sorts of different equipment for treatment of patients with those particular illnesses. And then we've got specialized staff that take care of these patients, because these patients are typically in the hospital 4 to 6 weeks. And so we have rehabilitation nurses, we've got occupational therapists, physiotherapists, speech therapists, and then the medical director has specialization in rehab medicine. So again, it's a well-rounded team to take care of patients with those specific needs.